My name is Ben Hechler. I'm an oral and maxillofacial surgeon and head and neck surgeon here at Duke University Hospitals in Durham, North Carolina. Today, I'd like to briefly discuss the TelScope Telehealth System and its application in various disciplines within medicine. I'd first like to start with our examine, capture, and connect sequence with the TelScope. The TelScope makes it very easy with the disposable illuminated tongue blades to examine patients, capture photographs using your smart device, and then connect using patient to provider connection, provider to patient, or between providers using these standardized images in our electronic health system. Now, I, as an oral head and neck provider, have a specific interest in using the TelScope for screening of oral potentially malignant diseases. And I think it's unfortunate that tens of thousands of Americans every year have these lesions progress to oral cancer, and many of them succumb to this disease. But I think it's even more unfortunate that the majority of these are not detected until later stages of the disease. We know that detection earlier results in better mortality and survival outcomes, and we therefore know that screening improves reduction in oral cancer mortality. But it's not just in oral head and neck applications that the TelScope has benefit. There are many other applications that I like to split into provider-initiated and patient-initiated applications. So first, some provider-initiated applications. I am very commonly in contact and in discussion with dermatologists, rheumatologists, and others, all of which who are following disease processes that have oral manifestations. And by taking intraoral standardized photos with the TelScope and sharing these, we have a good idea of the disease process control from a systemic perspective. Also in critical care medicine, we have many patients that are ventilated and have many tubes and drains in the oral cavity and throat for long periods of time. And although we have standardized methods of cleansing the patient's oral cavity using chlorhexidine, we don't have standardized methods of examining the oral cavity and monitoring progress, and the TelScope aids this significantly. Also in the discipline of anesthesia, our anesthesia colleagues are very commonly looking at parameters in the oral cavity and throat and documenting these to see if a patient is at increased risk of poor ventilation or intubation difficulties. Again, the TelScope allows standardized documentation that can be put in the electronic medical record to communicate these difficult patients to other providers. As I mentioned before, there are many applications in the head and neck. Monitoring of lesions, as I mentioned, is key, but this allows us to communicate as well with other general providers, such as dentists and primary care physicians, to communicate back and forth the progression of these patients' conditions. And then also communication with the pathologist. The pathologists always prefer and sometimes actually require standardized clinical information and photographs to perform an adequate diagnosis, as there are many diagnoses that actually cannot be made without this information. As I mentioned, there are also patient-initiated applications. Some of these are remote monitoring of lesions. We have many patients that live far away from our academic medical center, and if they perceive a change in an oral condition that's being monitored by us, they can take standardized photos, send those to us through their electronic health record, and we can easily identify to them if they need to come and be seen earlier than their next prescribed appointment. We also can monitor patients postoperatively using this device. Many patients don't necessarily require a postoperative visit, and we can check in with them using the TelScope so that they do not have to drive in many hours at times for a routine visit. And then lastly, infection monitoring or other recurrent oral and oropharyngeal disease processes can also be monitored using the TelScope, again, facilitating communication between providers and patients. Now, I think it's very obvious what the patient benefit is here, but you may be wondering what the provider benefit is. Well, as of 2021 in January, we have now changed our reimbursement. And in addition to increasing the complexity of a visit, the TelScope also increases the time that you spend with the patient and communicate to the patient's other providers. And this is now all reimbursable, where it was not before. For example, here are 3 CPT codes that are used for examining patients in the clinic, and you can see the associated time that is spent that day. This time is with any patient care, even if you're not seeing the patient face-to-face when you're performing care items for the patient. So for example, if I were to examine a patient with the TelScope device, discuss with them what I would be doing, of course, preparing to do that before the visit, and then uploading the images and communicating with the dentist, primary care physician, etc. afterwards. All of that time and complexity allows me to increase my reimbursement code and increase revenue for my practice. So not only is it a practice builder, but it directly increases revenue with each patient visit. Of course, it's not just about us as providers. As I mentioned, there's a huge patient benefit as well. And a lot of this revolves around the oral health disparities that we have here in the United States. This has become even more apparent during the pandemic, but there are significant numbers of Americans that don't have fluoridated water and other preventative measures. This leads to increased untreated cavities and gingival disease. And this really leads to the oral dental medical health discrepancies as well. You can see here in the bottom left, one of the biggest associations with untreated periodontal disease in women is premature low birth weight individuals, an 8-fold increase in that in these individuals who do not have these conditions adequately identified and treated early on, and many other medical conditions as well. Heart disease, diabetes, other inflammatory disorders such as atherosclerotic diseases and stroke. All of these lead to a huge, huge savings from early detection and treatment. So I thank you so much for your time, and I hope I was able to evidence to you the benefit of the TelScope telehealth system.